Hi, guys, and welcome to the Rare Wellness Podcast, the podcast designed to help you heal holistically and give you the tools that you need to thrive. We're making it easy to understand medicine and wellness with practical steps from the experts, one podcast at a time. The only thing that we ask is that if this episode helps you live just a little bit better and a little more aligned, that you'll leave us a review and you'll share this with a friend. That's all that we ask so that we can continue to provide you with free, valuable knowledge from the experts of well-being. In today's episode, we're going to be talking about wellness during pregnancy and everything you need to know when you're expecting. We're going to be diving into essential tips and advice for expecting mothers and their families, from managing pregnancy symptoms like morning sickness and fatigue, creating a birth plan, and preparing mentally and emotionally for labor and delivery. We've got you covered. We're also going to debunk some common myths about pregnancy and discussing the importance of postpartum care. Whether you're expecting or you want to prepare yourself for the future or just know how to better support those in your life who are expecting, this episode is for you, and we're so excited to chat today. Today, we're going to be interviewing Dr. Mara. She is a doctor of chiropractic. Dr. Mara specializes in pregnancy, postpartum, pediatrics, women's health, with credentials including Webster certification, certified birth and labor doula advocacy, and ongoing education in palate and breastfeeding assessment, craniosacral therapy, and dynamic body balancing, alongside working towards her perinatal certification through the ICPA work, and she's currently working at the Adjustment Chiropractic. Her passion lies in empowering individuals through holistic chiropractic practices and education to take control of their health while creating a safe place to ask questions and be curious when it comes to the norms in not just the birth world, but in women's health as a whole. Dr. Mara, I'm so excited to chat with you today. You have such a wide range of certifications and such an expert in your field. I'm so excited to learn from you. So
yeah, I'm really grateful to be here and excited that you asked me to be on.
Yeah. Okay. So I like to ask every guest that comes on, what does wellness mean to you? Because I feel like everyone has their own take on it based off of their training and where they come from. So what does wellness mean to you?
Yeah, well, within chiropractic, it's a very holistic type of perspective. So you're not just looking at your physical well-being, but for me, it's about achieving this state of physical, emotional, and mental balance in all things. And it doesn't have to be balance and we're always great in this one area, but it's figuring out where we need to work at from day to day. I remember going through chiropractic school and being okay, this quarter I really need to work on my adjusting skills, and this quarter I really need to work on my business skills. And then it's kind of finding that balance even in how we're presenting and the way that we work through different things too.
Well, and like you said, it changes over time. I love your definition because it's unrealistic to expect ourselves to be on top of everything in every season. It's the balance comes when it's over a long span of time you've invested in every branch, but it's impossible. We're all human. You can't do all of it all at once. So
exactly. Yeah.
I love that definition. So let's dive right into it. Talking about pregnancy today for expecting mothers. The first trimester is, how did you get started working with women in particular and get interested in pregnancy and labor and delivery and working with women in particular?
Yeah, it was, so in chiropractic school, the whole reason that I decided to become a chiropractor was because I had a lot of concussions that led to a lot of migraines. Sorry about my cat.
No, you're good. I didn't even see.
I had a lot of concussions that led to really, really bad debilitating migraines, and I had post-concussion symptom for years. I received my first concussion my sophomore year of high school when I took a soccer ball to the face, and then I got another concussion on top of it.
That is not fun.
Yeah, it was a really, really rough time. And then going to college afterwards, I ended up just being put on more and more medications. My parents had no idea what chiropractic was, or just it wasn't something that they immediately thought of when they were thinking of ways to help me. They just took me to their neurologist, and they just continued to put me on a bunch of different medications and everything. So it was not until I got to chiropractic school and found this whole path to get me there. I ended up switching at schools halfway through college. And when I switched schools, I had to apply to a bunch of different jobs because my scholarship decreased. I was a college swimmer, and I needed more money to pay for school.
Yeah.
So when I switched schools, I applied to a bunch of these different jobs, and one of them happened to be a chiropractic assistant. And it was the first time that I had had a doctor tell me that it was possible to heal on my own, and that I didn't necessarily, not that they told me to come off all my medications, but they were like, how do you feel being on all of these medications? Well, and I realized that I felt like shit. So once I got to chiropractic school, I realized how much my mom played a role in like taking care of me while everything was going on, and how painful it was for her to have to watch me go through everything. And just like that feeling, I don't have any kids yet, so I can't speak as a mom, but they always say like the worst thing that can happen as a parent is you're like having to watch your kid pass away. But I think close second has to be like watching your kid suffer and not knowing what to do.
Yeah, no, I know that so many parents experience that, and having for you to go through that is not fun. And it's crazy how I feel like drugs are the first thing that's always pushed, especially in like traditional medicine. It's very rarely do we really get down to the root cause and find a way to fix it. It's like, well, this is just how it's going to be. And here's all of the pills you're going to take, and not even really taking into account all of the side effects, the ways that it affects people's life, the way, like you said, you know, when you're dealing with injuries or sickness or illness, like it's not just affecting you, but it's affecting your circle. That's so did you start to use alternative treatments and like use chiropractic? Did it help you heal? And was that like when you got into school that you started, did you end up weaning off of the drugs?
It was actually before I went to chiropractic school that I came off of everything. It was, so my junior year of school, I started at my new college in North Carolina. And when I switched schools, I started that job at the chiropractic office.
Yeah.
And when I started there, they had like just slowly started introducing different ideas, like even just talking about birth control, which I had been on since I was in 6th grade. And I was now.
They prescribe it for everything. It's like you come in with a headache, birth control. You come in with like, or it's crazy.
Yeah. Headaches, period cramps, acne, anything. Everything. And then we haven't studied the long-term. I could do like a whole other podcast with you just talking about birth control.
We should. Yes.
Women's health, because that is another area that I'm hugely, hugely passionate about.
Yeah. Let's do it.
I feel like it was like
this rabbit hole. Yeah.
Yes. And so I did, when I started working at that chiropractic office, within 2 months, I came off of every single medication. I was taking steroid injections every other month. I completely stopped going for those.
Wow.
Yeah. And it was like literally a gallon-sized bag of medication that I had been on for
years,
4 years at that point.
What did that do for you getting off of it?
I mean, it was just a huge, I had started to realize those, I guess like 4 years in, that like I wasn't recognizing who I was anymore.
Yeah.
I started having just even more symptoms and even more symptoms. So coming off of it, it was kind of like, at first, it was like being underwater and coming up to a haze of smoke, because I still didn't fully understand who I was, and I didn't fully have like that connection to myself yet. But slowly the smoke goes away and I was able to start breathing again, but it just took a really long time. And I feel like there are certain things that I'm still detoxing from.
100%.
Especially I tore my ACL and broke my nose while I was in chiropractic school. So it was like going back on different medications for a short period of time when I hadn't taken pain medication in 2 years. Long. And then just like recovering mentally and physically from that too.
Man, you've experienced all the injuries. I know a lot of people though listening can probably relate to number one, the struggle of going through something that makes you feel like you're not yourself, you know, and being put on medications, and then going through that whole experience. And I love what you said about like just wait it out, like the fog will clear. Like you will come to find yourself again. So I love that. And thank you for sharing your journey. Yeah. Today's episode is sponsored by Rare Planet Health Supplements. I am such a firm believer in making sure that our body gets the nutrition that it needs for optimal physical performance, brain performance, and overall mood and vitality in life. Rare Planet Health has several different supplements that I have been integrating into my routine and that I highly recommend. But the one that I really want to talk about today is Rise. Rise is a dietary supplement that is a multivitamin, a probiotic, and also is formulated to help boost mental clarity. Whether you're an entrepreneur or you just want to be the best that you can at whatever it is that you're doing in life, this supplement is a great addition to your wellness routine. The bottle is super cute, which makes it really easy to integrate into your routine every morning, and it's designed to help strengthen your attention span with vitamins to help up your mental game, which I think in a digital era, we can all use. By combining a multivitamin and a probiotic, you can combat mental and bodily fatigue with a single supplement. It also provides support for intermittent fasting, improving your energy and productivity while decreasing your food cravings, if that's something that you practice, and it has a large dose of vitamin A and B12, which will help your organs, nerves, and red blood cells remain healthy, as well as your skin and hair. The capsules are super easy to swallow, and each bottle contains 60 capsules, which should last you 1 to 2 months. They also offer a premium fish oil, which if you've listened to any of our episode with functional nutritionists and functional medicine doctors, as well as women hormone optimization, fish oil and omega-3s are so important for vitality and a healthy diet. They also have Ageless, which is a stem cell joint and tendon support supplement, and a few more on there. You can get your supplements at rareplanethealth.com and use code RareWellnessPodcast10 at checkout for a discount on your supplements. Again, that's rareplanethealth.com. Use code RareWellnessPodcast for 10% off on your supplement purchase. This podcast is also sponsored by Rare Wellness Med Spa and Wellness Studio. Rare Wellness is a space where you can connect to yourself and get all the tools that you need to thrive and heal and be your best self. Whether you're looking for premium yoga, bar, or movement classes, functional medicine, aesthetic services, massage services, IV hydration therapy, and more, Rare Wellness is the place for you. To get 10% off any service at Rare, use code RareWellnessPodcast. You can book at rarewellness.com or the MindBody app. Lastly, this podcast is sponsored by NWC4RM.com, Northwest Center for Regenerative Medicine. If you're looking to reduce pain and avoid surgery, this might be the solution for you. Get back to the activities you love without surgery with regenerative medicine. Regenerative medicine is a non-surgical orthopedic procedure for joint pain, arthritis, and injuries. If you want to learn more about regenerative medicine and if this might be the solution for you so that you can avoid those surgeries and continue to get back to the activities you love operating at full capacity, go to nwc4rm.com. Regardless of where you are in the country, you can book your appointment there and do an online consultation so that you can see if this is the right fit for you. Receive a free info packet by going to nwc4rm.com and just entering your email, and you will receive more information to learn more. All right, let's head back to the episode. So how did you end up working with pregnant women in particular? So you're in chiropractic school now. Yeah. You've experienced the power of it. You've started your journey. You want to help other people. How did you get particularly to like women?
Yeah, it was, well, one, we had this, I was part of a group called Kairos Training Culture, still am, but we trained together all the time practicing the art of chiropractic. But I was a leader for the group at my school, and it was at different schools. And so when we went to one of our training camps, or we call it a facilitator camp, we had this exercise that we were challenged to tell our story and our why for chiropractic from a different perspective. And so I told my story of my concussions, but through my mom's perspective. And I was like, oh, shoot, this is like really why I went through everything, is not just like to help the kids that were like me and work with concussions and stuff, but to help the moms realize that like there are other options. And so often we're just shoved towards one route all the time. Yeah. And then it leaves a lot of moms feeling like not unworthy, but
like, did I feel my child? Yeah.
Yeah, exactly. And like, especially I'm my mom's first kid, but she has
Yeah.
two others after, but there's like so many things that you go through as a first time
Yeah.
mom, even when your kid is 16 years old, like
You've
who
never been
expects
here
you to go
before.
through that? Exactly. And then I had an incredible pregnancy and pediatrics teacher, Dr. Jen Santos, while I was in school. And I did part of my preceptorship with her and just starting to learn about pregnancy more and seeing her passion for it too. And
Yeah.
learning, honestly, it was more like the learning about how quickly women get caught up in the traditional medical system, and like the medical cascade of interventions that happens during labor and delivery was a huge part of why I wanted to get into this. And I knew that I wanted to be able to have some form of way for advocacy for
Yes.
women. So I've started with the birth and labor doula first, and we'll see where that goes.
I love that. I love that it was your relationship with your mom that inspired you on this journey to really work with women. And let's dive right into it. So, what are some tips for women who find themselves pregnant and they're in the first trimester? Like, what are some essential tips? Like, what is the keys during that first trimester for people listening?
I think that the best tips during the first trimester is one, most women are pretty exhausted during
Yeah.
that first trimester. So focusing on like rest, nutrition, stress management. A lot of times they're having morning sickness. So eating like smaller meals throughout the day or keeping dry crackers nearby or having little ginger candy chews or tea, something that can help try and calm the nausea. And then with the fatigue too, just like prioritizing more rest and sleep. If you have the ability at your job to be able to take more naps, I know a lot of people work from home now. So being able to
Yes.
like break your work day up into smaller bits if you're able to, or maybe you work on Saturdays now and take Wednesdays off in the middle of the week,
Mhm.
something like that.
You're
Uh,
literally growing a whole human.
yeah,
Yeah.
exactly. It's exhausting.
It's exhausting. It's a
And
full-time job. Yeah.
exactly. And so much is happening in that first trimester for you to grow and be able to sustain a pregnancy that like this. I think the stress management stuff is huge. Like gentle yoga or breathing exercises, meditation, and then just starting to figure out like what is this birth going to look like for you and starting to have that vision because it might be 9, 10 months long journey, but it also
Mhm.
like happens very quickly when you're feeling so exhausted. So getting like small chunks out of the way when you are feeling good, figuring out prenatal vitamins.
Mhm.
Side note, I think all women should be taking prenatal vitamins well, like over a year before they even want to have a baby.
What
But
does it look like?
what does it look like?
Yeah, like what are or I guess are there where do you get your prenatal vitamins? Like does it are all vitamin like are all prenatal supplements created equal? Yeah.
Okay. So when it comes to prenatal vitamins, there is folate, which is naturally occurring, and then there is folic acid, which is the man-made form. So when I'm looking at prenatals, a lot of times I will look for something that has folate instead of folic. There are certain
Yep.
people that have a genetic mutation and cannot break the naturally occurring folate down into folic acid. So if you have started your prenatals early, then this might be something that you're able to tell a difference in just in how
Mhm.
you're feeling and everything too. So I think that it's great if we can start prenatals a little bit earlier. It's also
Mhm.
just great starting to prepare your body before pregnancy too, especially with like the increase in miscarriages and
Infertility.
infertility that we're seeing in so many women.
I think it's really interesting how I feel like most women we're not educated on our bodies well enough, period, like even outside of pregnancy. Like so many of us
Yeah.
are so out of touch with understanding our hormones, understanding our cycles, understanding just like how we operate because I feel like so many of us women have been trying to operate like a man in a man's world for so long that we're just so out of touch with women's health in general. And then on top of that pregnancy, I feel like there is a huge lack of education on just understanding what's happening to your body during pregnancy and how you can take care of yourself. I love what you're saying, even about folate versus folic acid, and just even knowing like stuff like that, or that you should be taking if you're wanting to get pregnant, start taking it a year before. Like, these are just such helpful tips to know.
Yeah. And it's so much more than that too when it comes to like exercise and things.
Yeah.
Like, to help have a smoother labor, being able to have mobility in our hips. And so many of us are sitting all day long, every single day, and have lack of mobility. And then a lot of us don't work out, or at least not as much as we should. And then when we do work out, we're just lifting heavy and not focusing on the ability to relax our pelvic floor. And when it comes to pregnancy, we're having like such a hard time relaxing and letting go. Yeah.
Have you found that there's like a lack of education in like pregnancy and women's bodies, like within your practice?
So much. Yeah. That's one of the reasons that I did a labor and doula certification that had an advocacy program attached to it, because not only when I'm there at somebody's birth will it be helpful, but also when like I'm there educating them in their office at 12 weeks when they just found out that they're pregnant. You can already start talking with them about these different things. But it's also like balancing the line, because some people don't want to know, and that's true. Okay too.
Yeah.
But there are some people that just would live like under this sheet of like, this is how things should be, and this is what birth looks like for every single person. So I'm gonna do an induction. I'm gonna get an epidural. I'm gonna have a planned C-section. Like, there are these things, but also there are people that want to cherry pick these things and not understand the risks to them too, and then they're not explained to us. Right? If you have an epidural, or if you get induced, you're more likely to have an epidural. And if you have an epidural, you're more likely to need Pitocin. And if you have Pitocin, you're more likely to have a C-section.
So this is where I love your emphasis on education, because like you said, it's not that there's anything wrong per se with choices that people get to make, but it's the fact that we are not educated on, you have options. Like, it doesn't have to be done this way. And like you just said, like there's cause and effect to every choice that we make. And it's just like, whatever choice that you decide to make with your body during your how you want to do your pregnancy, how you want to deliver, like it should be done with full awareness of your options. And I love that. So coming back to the first trimester, morning sickness is something that a lot of people deal with. So can you share any advice on managing pregnancy symptoms during that first trimester?
Yeah. So morning sickness and fatigue are the two biggest ones that I see and hear from people. One, morning sickness. A lot of people are like, morning sickness, oh, it's just going to happen to me in the morning. No, it can happen anytime throughout the day. So it's just like nausea in general.
They should just call it like sickness. Like,
yeah, just like pregnancy related nausea.
Right. Yeah.
But so some of the things you can do for the morning sickness symptoms is like eating smaller meals, having like crackers and toast, things that are very light on the stomach that you can have kind of throughout the day when you aren't feeling nauseous, just to get something down. Also avoiding like a lot of the foods that feel like triggers. One of my friends is pregnant right now, and her entire first trimester, she loved eating meat, but like she could not be in the house while her boyfriend was cooking the meat. And really? It was like, she just couldn't, it was just the initial smell of it cooking. So just avoiding those triggers.
Isn't it so interesting how it's so different for every person? I wonder like what causes it. Do you know what causes it?
That is a great question. I don't know.
Yeah. It's so funny to me. Like, everyone has like their specific cravings and like the things that like repulse them. And it's so interesting.
My mentor, Dr. Jen, always knew that she was pregnant because she would crave pickles, like dill pickle chips, pickles.
She's like, I don't even need a pregnancy test. I know my sign. She's like, I'm craving pickles. It's here. That's funny.
Exactly. Yeah. So for morning sickness too, like ginger tea or ginger candies are really good options, depending on like what you can keep down. The tea is really good because you want to stay hydrated during this time too. Yeah. And finding some supplements that can be supportive of that. I really like everybody has different opinions on electrolytes. I personally use Element. Some people
I
don't
do
like
too.
the stevia in it. I don't care. If I'm going to, yeah, I like Element. And so I recommend it too, especially for moms, because it does have the magnesium in it too.
Do you have a favorite flavor? Just out of curiosity. I
Oh,
love Element.
yes.
I'm obsessed. Which one?
Okay. My all-time favorite, if I'm just going to drink it on its own, is raspberry.
Raspberry is so good. I feel like the
And,
raspberry watermelon, like those are so good. Yeah.
and then I went, this is like a side tangent, but I went floating on the river in Leavenworth this past weekend.
Oh, so
And we
fun.
used the citrus salt ones to make margaritas.
Wow.
It was
Adding that
so good.
hydration to that's amazing. Have you tried the chocolate one? I feel like that's like a hot take. Like some people love it and some people hate it.
I have one in my pantry right now because somebody told me that I need to try it in my coffee.
So I feel like people have said it tastes really good hot. I honestly like it cold. I just feel like I'm drinking like salty chocolate milk. I know that sounds nasty,
Really?
but
Maybe I just
I
need to
love it.
buck up and try it.
I think you should let me know how it goes. I'd actually be really curious what your thoughts are. So
Yes,
maybe
I
put like
will.
half a packet in like cold and half a packet in hot. But no, I definitely agree. I know that anyway, I love electrolytes. I know I used to drink so much water and still feel like thirsty all the time. And since I've started using Elements, especially since like I do move a lot and sweat a lot, like it has helped me so much in just like my hydration and my recovery. So it's cool to know that, okay, so that is something that's important for women during the first trimester. Is there anything else with morning sickness and fatigue?
Well, I kind of mentioned it before, but if you're able to move your schedule around and like take more naps during the day, that can be really grateful. That can be really great for battling the fatigue.
Yeah.
Help boost your energy levels a little bit if you're able to just like prioritize more sleep too. Like, don't be afraid to go to bed at 6
Yes.
p.m. if your body is telling you that's what you need. And then also like having a partner that can support you in that way and allowing you to take a nap when you need to is very helpful.
I think what pops into my head as you're talking is advocacy for yourself, like even in the workplace or at home or whatever it is. Like I think sometimes as women, like we're afraid to ask for what we need because like we don't want to step on people's toes, or like we don't want to like cause a scene, or we're afraid to advocate for yourself. But it's like, don't be afraid to ask at your job for what you need, or like at home or with people. I don't, you don't, I feel like sometimes we shouldn't need permission, but sometimes we just need to hear someone say like, you're okay. Like ask for what you need from the people around you. Because sometimes you'd be surprised, like people are willing to give you what you need if you'll just ask.
Absolutely. Yeah. And again, it's like we've been forced into, or not forced, but like a lot of us have this like go, go, go mentality where we like
hustle.
Just like the hustle mentality. And so like asking for the ability to step back when we're in a more vulnerable state, like we're not feeling our best, is very challenging.
Well, yeah. And I also just like, off of what you're saying, like I believe that there's such a beauty of like you're literally the portal to life. Like you are bringing life into this world. Like take the time to savor it. Like don't miss those moments because you don't get them back. So I love it. So birth plans. Let's talk birth plans. So like what are important things to consider when you're trying to create your birth plan?
Yeah, there is a long list. So first, like knowing the birth setting, where you want to give birth. Do you want to give birth at home? Do you want to give birth in a hospital? Do you want to give birth in a birthing center? There are some hospitals now too that have like birthing centers in them, which has been a great option for some people. The hospital here in Spokane, Deaconess, has that option, which is really, really great for people that want like some sort of middle ground. And then also like the next big thing to decide is like your support team. Are you going to use an OBGYN or are you going to use a midwife, or are you going to try and use a combination of both? Are you going to have just like your partner there, or do you want family to be in the labor and delivery room? Do you want a doula there? Being able to understand too that like just because you have a midwife and you're giving birth at home doesn't mean that you don't also want a doula. A doula is there to advocate for people and like help make those not make those decisions, but help check in with you when you're in the thick of it during labor and you're like in labor land and not necessarily understanding what's going on, to make sure that nothing is happening without your permission and your consent.
So for the woman who's listening to this and maybe is not familiar with like all of the different like roles that people can play in delivery and in pregnancy and on the journey, can you do like a super brief overview of like what is the difference between a midwife, a doula, and like your OBGYN, and like what are the different roles that they would support?
Yeah. So with an OBGYN, you're going to go into the hospital. They're usually somebody that you've seen like as a primary care physician throughout like just life in general. You can go to your pap smears or whatever it is else that you need to get done with them in the past. A midwife is just somebody there who is for birth, labor, and delivery. So there are hospital midwives. They are very different from home birth midwives, in my personal opinion, because they are still constrained to the rules and regulations of a hospital. So whenever somebody comes in and they tell me that they have a midwife, I'm like, where's your midwife at? Are they like a private midwife, or are they like a hospital assigned midwife? So that same thing with your OBGYN. They have a lot of protocols that they have to follow. And it's just like little things like, oh, if you're doing Pitocin, we have to up your Pitocin by this much every half an hour. We don't have to check in with you. Those types of things. However, even for a home birth midwife, they might have their own set of protocols too, where they just do stuff and don't necessarily talk through it. And so for me personally, that's where a doula comes into play. And a doula is somebody that is there as a support system, whether it's physical, emotional, mental. A good doula will be an advocate for you when you're in the labor land type deal that's going on. And they will also be somebody that helps prepare you for birth. So a good doula is somebody that like you could give birth 5 minutes before she showed up and you would feel comfortable because they've prepared you so well for your birth.
Do you think everyone needs a doula?
I think that everybody that can have a doula should have a doula. Yeah.
100%. Yeah.
Whether you're giving birth in a hospital, whether you're giving birth at home, there's so much when it comes to being a first-time mom, and like also just being exhausted too in that first trimester. And even later on, the fatigue, everybody's a little bit different. And so having somebody else that you can rely on and like be there for support, and you can ask these questions and they can help guide you through coming up with a birth plan. They can help kind of figure out what your intention is for your birth and connecting you with people, helping you with support. Most doulas will also do a postpartum visit for you, at least one, so that they can check in and make sure that you're there. But there are also like just postpartum doulas who will come and like help clean your house, hold your baby while you take a shower, help cook for you, things like that too.
No, it's so special too to have someone who, I feel like it brings a sense of peace when you know that you're having someone who has walked with so many other people through their journey before, know that can help you know that you're taking all the right steps for yourself, and to have like the best experience that you can with your pregnancy and delivery.
Today's episode is sponsored by Rare Planet Health Supplements. I am such a firm believer in making sure that our body gets the nutrition that it needs for optimal physical performance, brain performance, and overall mood and vitality in life. Rare Planet Health has several different supplements that I have been integrating into my routine and that I highly recommend. But the one that I really want to talk about today is Rise. Rise is a dietary supplement that is a multivitamin, a probiotic, and also is formulated to help boost mental clarity. Whether you're an entrepreneur or you just want to be the best that you can at whatever it is that you're doing in life, this supplement is a great addition to your wellness routine. The bottle is super cute, which makes it really easy to integrate into your routine every morning, and it's designed to help strengthen your attention span with vitamins to help up your mental game, which I think in a digital era, we can all use. By combining a multivitamin and a probiotic, you can combat mental and bodily fatigue with a single supplement. It also provides support for intermittent fasting, improving your energy and productivity while decreasing your food cravings, if that's something that you practice, and has a large dose of vitamin A and B12, which will help your organs, nerves, and red blood cells remain healthy, as well as your skin and hair. The capsules are super easy to swallow, and each bottle contains 60 capsules, which should last you 1 to 2 months. They also offer a premium fish oil, which if you've listened to any of our episode with functional nutritionists and functional medicine doctors, as well as women hormone optimization, fish oil and omega-3s are so important for vitality and a healthy diet. They also have Ageless, which is a stem cell joint and tendon support supplement, and a few more on there. You can get your supplements at rareplanthealth.com and use code RareWellnessPodcast10 at checkout for a discount on your supplements. Again, that's rareplanthealth.com. Use code RareWellnessPodcast for 10% off on your supplement purchase. This podcast is also sponsored by Rare Wellness Med Spa and Wellness Studio. Rare Wellness is a space where you can connect to yourself and get all the tools that you need to thrive and heal and be your best self. Whether you're looking for premium yoga, bar, or movement classes, functional medicine, aesthetic services, massage services, IV hydration therapy, and more, Rare Wellness is the place for you. To get 10% off any service at Rare, use code RareWellnessPodcast. You can book at rarewellness.com or the MindBody app. Lastly, this podcast is sponsored by NWC4RM.com, Northwest Center for Regenerative Medicine. If you're looking to reduce pain and avoid surgery, this might be the solution for you. Get back to the activities you love without surgery with regenerative medicine. Regenerative medicine is a non-surgical orthopedic procedure for joint pain, arthritis, and injuries. If you want to learn more about regenerative medicine and if this might be the solution for you so that you can avoid those surgeries and continue to get back to the activities you love operating at full capacity, go to nwc4rm.com. Regardless of where you are in the country, you can book your appointment there and do an online consultation so that you can see if this is the right fit for you. Receive a free info packet by going to nwc4rm.com and just entering your email, and you will receive more information to learn more. All right, let's head back to the episode.
Is there more that we want to talk about the birth plan, or?
Oh, yes.
Okay.
So birth setting, support team, pain management is another one. So then it kind of like breaks down into also like labor, birth, and then also like post-birth, what all you want to. So it's pain management, interventions, and then like the postpartum care. But when it comes to actual labor, knowing about IVs, do you want IVs? Do you not? When you get to the hospital, vaginal exams is another big one. Do you want vaginal exams? Do you not? Sometimes in the hospital to be induced, you will have to have a vaginal exam, and some hospitals to even admit you back for labor and delivery will require you to have a vaginal exam. So if you're giving birth in a hospital, that's also a great thing to be able to know.
What do you think are the benefits of all of the things that you're recommending versus like how do I know if it's right for me? How do I make that decision?
I feel like most people need to talk to somebody that they trust. I could give my opinions on it all day long and what I think is best, but ultimately, like,
it's so individual.
Yeah. And one of the biggest things becoming a doula is like working through what your biases are. So like there are certain things that I obviously will always feel a little bit stronger about just based off of my background and my knowledge, but it's also not my place to put my opinion on other people. So when people reach out about like, is this right for me? I'm going to give them resources of like the pros and the cons. And we could do a whole nother episode just going through like labor, birth, and post-birth interventions and what the pros and cons of each of those things are.
Let's do it. Yeah, I feel like it's like so hard. There's so much, like every one bullet point that we're talking about, it could be like its own thing. Yeah.
Yeah. It's like there's little rabbit holes that you could go down for every single aspect of this. So
yeah.
Some other things to note are like, do you want to eat and drink during labor? Some hospitals have a policy against that. Do you want intermittent monitoring or constant monitoring? Do you want artificial rupture of your membrane? So when they like break the water, there's pros and cons to that as well. An interesting one that I learned about when I was becoming a birth and labor doula was, do you want a student or a resident to be able to perform different things on you?
Wow.
Yeah, like, do you want a student to be able to place your epidural, or would you like us to ask that student to not and get the doctor?
Yeah.
So epidural is another one that is huge during labor. And then how to decide if you've said that you don't want an epidural. Do you have a code word? Like when you've said that code word 3 times, okay, I've changed my mind officially. Because some people, they end up just needing it, especially if they're doing Pitocin or things like that as well. Yeah. Pitocin's another big one. Induction. And then during the birth, do you want coach pushing? Do you want the lithotomy position with your like legs up in the stirrup? Or do you want the ability to move around? If you have an epidural, there are some hospitals that will do a walking epidural. There are some hospitals that won't do it. So it kind of depends on like where you're giving birth to on some of these things. And that's why it is great to have a doula that knows the hospitals and can ask a lot of these questions. Because if you come into a hospital and you're like, I want to eat and drink, I want to be able to move around in my bed, and I do not want a student to touch me, and you're going to a hospital that has a policy of no eating and drinking, you have a teaching hospital, and they don't let you get out of your bed, especially if you have an epidural, then like maybe we need to talk about other options for where you want to give birth.
Absolutely. And I think this is why it's so important to like be thinking ahead and like think about these things early on so that you can really know that your experience is going to be what you want it to be. You know, it's like such a special day and moment in your life. So I love that. Yeah.
It's a lot. And then, also who's catching?
Yes.
You want hands on or who's hands off for like pushing feedback? A lot of times when somebody has an epidural, and this is like new information to me, so hopefully a new mom also knows it. When you've had an epidural, it's really hard to connect with your pelvic floor. Feel where you're supposed to be pushing. So some doctors will be able to like place their hand in the vaginal canal and like up into your cervix to help increase that brain body connection. But if you get vaginal exams done and then they just like start doing this, how are you going to feel about that too?
Totally.
And then post-birth, how long do you want to wait before cutting the cord? Different hospitals have different policies about that as well. Pitocin, a lot of times, even if you didn't have Pitocin during your actual labor, they will give you Pitocin after birth to help birth the placenta. And a lot of times it just happens automatically in a hospital setting. So if you didn't want Pitocin at all, that needs to be something that like, hey,
communicate. Yeah.
Skin to skin is another big one. How soon do you want that? And then what is the hospital policy too? A lot of people don't realize that they can do everything except baby's weight and height on mom. So there is no reason to like take the baby out of the room, of course, unless there was like some sort of complication with the delivery and they needed to take them to the NICU. Then that's also a great thing. If you have a doula there, do you want the partner to go to the labor or to the NICU with your baby, or do you want your doula to go and so that your partner can stay there with you? So just like having somebody there, or even if like it's your mom, want your mom to go to the NICU with your baby and your husband stay here, or what's gonna happen there? Placenta, are you going to keep it or not? It's another big one to decide.
What do people do when they keep their placenta? Just
well, okay, so it kind of depends on the person. This is one of the things that I am working through my own bias with, but some people keep it and encapsulate it. So, and then, or they can even just like dry it out and put it into a powdered smoothie. You could just not, and then you can just throw it into a smoothie raw.
Some people do eat it.
Yeah, a lot of people eat it.
That's crazy. I mean, it's awesome for them. Yeah. It's such a like, I feel like it's so, actually, no, I'm going to leave out all my comments. Keep going.
No, we can cut it out, but I would like to know.
I was like, it kind of grosses me out, but also I'm like, but is there a benefit? Like, I'm like in this like duality where I'm like, oh God, can I do that? Would I be able to do that? But then I'm like, you know, good on them for doing it. I don't know. I'm like in this, like, I don't know what my thoughts are on it. It's just interesting.
Used to be very hardcore, like, oh yeah, I'm totally going to do it. But then I dove more into like, what is the placenta? And I realized the placenta is not my organ. I'm not eating my own organ. I'm eating my baby's organ. And not only that, I am eating the organ that like was giving nutrients and filtering out toxins to my baby. So my question is like, do the nutritional benefits of that organ outweigh like the toxins that are in it? And like how toxic were you during your pregnancy, or like what were you exposed to? Even just living here with a bunch of wildfires and like, I'm like, I don't know. Wow. So I go back and forth on it too. So I have like
I'm going to leave this in because, I have never even, like, I didn't even know that. I've never thought about that. All of this. Yeah. I guess that's another thing you talk about.
I could eat my baby's organ. Like,
well, it is interesting. Like you said, it's like, you think it's your organ, but when you really realize that it's not.
Yeah. It makes a big difference.
Food for thought, literally.
You can save it for your baby. Yeah. And there is also benefits to saving it long term for the stem cell use. So you could just keep it in your freezer and use it. And then if your baby ever gets sick later on, keep it for stem cell use. See if they can use it. So I think that instead of eating it, maybe just toss it in the freezer and let it hang out until your kid's older.
No, I love all of this information. This is, like I said, I'm learning so much. This is so good. I really genuinely wish that we talked more about pregnancy and women's health in school, everywhere. Just like, I feel like we don't like, there's no like standard education.
Yeah. Even as like a doctor of chiropractic, I feel like we like very much glazed over reproductive health in both men and females, but especially females, it's so much more complicated. And then like birth, we had a gynecology class, we had an obstetrics class, and then we had a pediatric and pregnancy adjusting class. And I'm like, there's so much more to be able to dive into.
It's the foundation to life. That's the crazy thing, is like, this is how we keep the planet going. So like, I feel like it's important. I feel like this is important information. So yeah.
Absolutely. I had one more like post-birth thing. I remembered what it was. It's baby meds. What type of medications do you want? So the 3 that are standard to give right after birth are vitamin K, Hep B, and the eye drops, erythromycin.
Yeah.
And so it's like really dependent on what you want. I could share my opinion, or I could share it.
No, I think
this will be the only one that I share on.
Yeah, I was gonna say, I think share as much of your opinion as you want, because at the end of the day, I think that's how people make informed decision, is hearing multiple perspectives on and you've studied this more than most of us have. So it's just helpful. And at the end of the day, people can pick and choose, and you have to filter. You can't just blindly follow anything. You have to filter. Yeah. So that's our responsibility as the listener, but share your opinions. I want to know. Yeah.
Okay. So vitamin K, you can have the injection, but you can also get it orally. Okay. There are like pros and cons to doing both. If you are planning to do a circumcision, which is another post-birth thing that you should consider beforehand. Mm-hmm. But if you're planning to do circumcision, you have to have the vitamin K shot. I don't know any hospital that will allow you to do circumcision without giving your baby vitamin K, because it's helping with blood clotting. And so the whole purpose of vitamin K is there to, if your baby had any sort of internal bleeding or damage coming out through the birth canal, that they have vitamin K, because it is not naturally producing at birth. But there is an option to do it orally. There are pros and cons to it. With vitamin K, you have to buy the oral version. Most hospitals in the United States do not have oral vitamin K. So it would have to be something that you buy online. preferably from a reputable source. And it is also something that you have to give at birth, but then you also have to give it again. I believe, don't quote me on this, do your own research too, but I believe it's 7 days. So you have to be able to do 2 different doses, because it's not until 14 days that your baby starts to produce their own vitamin K. Again, don't 100% on that one, but there is pros and cons to it. So look up the pros and cons on your own too. And then the next baby medicine is the erythromycin. So that is the eye drops. This is one that I am still very curious as to why we do it in the United States as a standard method of procedure. The purpose of the eye drops, erythromycin, is so that if mom has chlamydia or gonorrhea, they do not, and then they pass through the vaginal birth canal, you pass it to your baby.
Yeah.
But for some reason, we still give it to C-section babies. We give it to moms who have tested negative. We give it to just all babies as a standard method of practice. And I think that it is one that if you don't have chlamydia or gonorrhea and you tested during your pregnancy, you haven't had any other sexual partners during your pregnancy, then you can make that decision for yourself. And then the last one is the hepatitis B. So hepatitis B is another one that is very, very standard. Hepatitis B is a vaccine that is given to protect against sexually transmitted disease, dirty needles, things like that. Most babies aren't involved in sexual activity or using dirty needles. Again, it depends on like where you're living and what your lifestyle is like. And if you feel like you need to have that sort of protection for your newborn. But also it's a vaccine that they can get again later in their life. So they wanted to and don't necessarily have to get at birth. Yeah.
No, I think that these are crucial to think about. And thank you so much for sharing all of that with us, because I'm going to be, when the time comes for me to be in this season of life, I will be re-listening to this episode with a notepad, like writing everything down.
You can just reach out to me too. I'm sure I'll have even more info by then.
Oh, amazing. Dr. Mara, we have so much more to talk about. I feel like we're barely scratching the surface, and I have so many more questions. I know that our listeners are going to have so many as well. So we're going to continue this conversation in the part 2 episode. But before we end this and start the new one, can you just tell people really quickly, if they're listening and they're like, man, I have so many more questions, how can I talk to her? How can I learn more? Where can they find you?
Yeah, so you can email me if you want. My email is drdrmaratrowbridge@gmail.com. And then you can also just find me on Instagram and shoot me a DM through there. My Instagram handle is the same thing, @Dr. Mara Trowbridge.
Perfect. Well, thank you so much, Dr. Mara. We'll catch you in this next episode. Guys, if you're listening, be sure to also DM us at the Weird Wellness Podcast and send in your questions so that we can ask the experts on any wellness related topic that you have, but especially if it's pregnancy related, because I have a feeling like we're going to be having many more conversations. So thank you guys so much for listening. We'll see you guys next week. Bye.